If you have cancer and you are starting Medicare, which path should you go? Should you stick with original Medicare and get a Medicare Supplement policy, or should you go to Medicare Advantage, Medicare Part C? If you were my client and you were coming in under those circumstances new to Medicare, I would advise you to go to original Medicare, get a Medicare Supplement policy, and a standalone Part D plan. Let me explain to you why. Now, first, I want to tell you that that does not mean that I don't believe you can get good coverage if you need to go to Medicare Part C. But here's the reasons. When you're in original Medicare, you have no doctor networks. You can see any doctor across the United States. So when you're in a Medicare Advantage plan, you're going to have HMO and PPO networks. So you got to think about that. When you're in original Medicare, you do not need prior authorization. In other words, your doctor determines your medically necessary care. When you're in Medicare Advantage, there are additional steps. Your doctor could recommend certain care, but then the managed care company has to agree with the doctor before you're able to get that care. Now, you may say to me, well, the supplement is too expensive, but here's what you have to think about. First of all, when you're new to Medicare, you're 65, this supplement pricing is much more affordable than when you're 78 or 85. So you're going to start with that price, right, which will gradually go up each year. But the point being is that when you're in Medicare Advantage, yes, you'll probably have a $0 monthly premium, but the way the plans are written, you have a max out-of-pocket that you could spend. So with a max out-of-pocket, every time you get a service, you owe a copay or a co-insurance. And one very important co-insurance to know about in a Medicare Advantage plan is when you have Part B medications like chemotherapy, you're going to pay 20% of that cost up to that max out of pocket. So you may be like, I don't want to spend the $1,300 on a Medicare supplement policy, or maybe it's $1,500, but there's a good chance you'd spend that anyways under the Medicare Advantage plan if you do need those kind of services. The other issue to think about is, let's say you chose Medicare Advantage and you are sick, and now it's like a year and a half later and you're like, I think I want to try a Medicare supplement policy instead. The problem is you typically have to qualify with your health to get the product. So if you start with the supplement, you see how it goes for you, and later you want to switch to Advantage, you could do that. But in the reverse, you may have a problem being able to get that Medicare supplement policy.